Okay. Hi, everybody. Thank you for being here. Welcome to our Practicum 2 certification review session number 2. As always, I will be your instructor. My name is Miss Bree. We need to make sure that you guys are ready for the certification review exam. So with this certification review session, we will be using the packet to accompany certification review number 2. Please go ahead and download and print the questions so you can follow along. They are found on Blackboard under the Student Resources folder, under the Certification Review Sessions folder, and make sure you have packet number 2. Once again, we are utilizing our test-taking strategies. Just as a quick refresher, the strategies are going to be as follows. Number 1, read the question in its entirety. Stop. Don't look at A, B, C, and D. Take a deep breath. Even close your eyes. Try to answer it in your head. Okay. And then open your eyes and read the question again. So first 2 steps are always read the question once, breathe, take a beat, read the question one more time. Make sure you completely understand the question in its entirety, identifying any of those keywords. Make sure you fully understand what the question's asking. Third step is going to be to discard at least 2 options from your A, B, C, and D. That way you can get down to a 50-50 and easy. Number 4, answer your question with confidence. Try to do your darndest not to go back and change your answer unless you know for certain that you misunderstood the question or read it wrong. But go with your gut, answer the question with confidence. You already did your test-taking strategy, steps 1 through 3. Last step is just make your choice and stay with it. Okay. Learning objectives for this week is orthopedic surgery. We're going to talk about the anatomy and physiology and the intraoperative procedures. And then we are going to go into the preoperative preparations category. All right. Orthopedic surgery, anatomy and physiology review. Question number 1, I'm going to get out of presentation mode just so you guys can do this with me. So question is, which of the following refers to cells that are activated to form new bone tissue? And I'm not going to look at A, B, C, and D. I'm going to sit with that question in my head for a moment, take a deep breath, close my eyes, try to envision where I was when I either studied this information or learned it for the first time in class. Try to get your mindset in that space so you have a good possibility of remembering something. So trying to answer it in my head. I'm going to keep it to myself for a minute. I'm going to read the question one more time. So which of the following refers to cells that are activated to form new bone tissue? Okay. So I'm going to go through my questions A, B, C, and D, or excuse me, responses A, B, C, and D. Start to pick apart all of those answers and potentially even pick apart the question as well. So I'm looking for cells that form new bone tissue. So A is chondrocytes, B is osteoblasts, C is osteoclasts, and D is osteophytes. Now, I know from my medical terminology that osteo means bone. So B, C, and D are already off to a good start, but A is obviously a little different. We've got chondro, and I remember from my medical terminology that chondro means cartilage. So I'm going to get rid of A. Okay. Now, we have osteoblasts, osteoclasts, and osteophytes. I remember that in class we talked about using a double action ronger to remove osteophytes, especially during total joint arthroplasty. And I remember from class that osteophyte is another way to say a bone spur. So I'm going to get rid of osteophyte as well, because although a bone spur is potentially new bone tissue, I don't believe that's what the question is asking. Okay, so I'm going to get rid of it because B and C are the best potential options. Osteoblasts and osteoclasts are both cells that are responsible for modeling or remodeling bone tissue. They just have different jobs. One is more of a demolition crew, and one is more of a rebuilding construction crew. So the way that I remember between osteoblasts and osteoclasts. So I remember my alliteration. I use B and B. Osteoblasts are going to build bone. Okay, so blasts build bone. I kind of use my alliteration there. So I'm going to go with B as my final answer. Okay. And I am indeed correct. Here is my, I guess, tips on the bone cells that are responsible for modeling, remodeling, and maturing into adult bone. So, like I said, I'm going to jump into the center here. I'm going to start with blasts just because that was our answer. So osteoblasts are going to be our builders. They are going to also promote bone mineralization. Osteoblasts are found on the surface of bone. Your osteoclasts, that's what I referred to earlier as our demolition crew. I often use my alliteration here as well. I use C and C. Osteoclasts collapse bone. So what they do is they will function in bone resorption. They will essentially collapse the surface bone cells to release calcium into our bloodstream. And then the blasts will rebuild the bone when the calcium levels in our bloodstream have normalized. So that's what osteoclasts and blasts are going to do. They are big players in helping maintain our blood calcium levels, and the blasts kind of keep the clasts from completely collapsing all of the bone tissue. The osteoclasts themselves originate in bone marrow, relocate to the surface of the bone tissue when we have to undergo remodeling or repair. And then a third player that we didn't talk about that are osteocytes, those are actually going to be deep within the structure of adult bone, and they're going to distribute substances through the bone, provide that cell-to-cell communication, and detect stresses induced in bone. So our osteocytes are essentially the cells of adult mature bone tissue. And I've got a photo here that you can see kind of the beginning to end of the demolition and rebuilding cycle when our blood calcium levels are low, or if the osteocytes identify any stress or damage to the bone cells, the osteoclasts will come in and kind of collapse those bone cells that have been traumatized, or the bone cells that are holding calcium so that they can release the calcium into the bloodstream. One of those two, but that's what the osteoclasts are going to do, is going to collapse or kind of come in and become a demolition crew, kind of break down some of that bone tissue on the surface of the bone, and then the osteoblasts will reform the bone once all is said and done. Okay, so this is your turn. You're going to answer numbers 2 through 15 using our test taking strategies. When I say pause, pause the video, answer numbers 2 through 15 on your own, and then when you're ready, play, and then we'll go through the answers together as a group. Okay, on the count of 3, 1, 2, 3, pause. Welcome back. Okay, we're going to do a little rapid fire because last video was pretty long. So stay with me. We're going to just go through the answers as a group. So number 2, our answer here is osteomyelitis. Number 3, the answer here is diaphysis. I have a picture here of the structure of long bone where you can see those structures in detail. Number 4, the suture lines of cranial bones are synarthroses because synarthroses means an immovable joint. Number 5, ball and socket of the shoulder is the glenoid fossa and the humerus. Number 6, our answer here is going to be the thumb. And little image here, I believe this is also located in the textbook, but different examples of different classifications of joints. So ball and socket joint being the hip, condyloid joint being the wrists, and so on. Number 7, a fracture that breaks into multiple pieces is comminuted. Okay. Number 8, our answer here is a foramen. In the textbook is a box that has common landmarks of bone. I suggest that you review this quickly on your own. Number 9, answer here is pectoralis major, because the 4 muscles associated with the rotator cuff are your supraspinatus, infraspinatus, subscapularis, and teres minor. Number 10, autoimmune disease is going to be our rheumatoid arthritis. Number 11, the answer here is cortical bone. You can see the Haversian units and the canals between them in the cortical bone here in this image. You can see a little bit further in towards the apex of that wedge of bone, the different structure of cancellous bone. Also, if you noticed, A, C, and D all mean the same word. They all refer to this cancellous bone. 12, answer is A, abduction. Certification questions like this come up often, either in reference to orthopedic surgery or in positioning the patient. So I suggest you review the types of body movements. Number 13, our answer here is going to be C, hallux valgus. Number 14, the answer here is transcervical. D. Here is an image of certain hip fractures of the proximal femur that can happen. These are not the only fracture patterns, but these are some of the most common ones. And you can see here the transcervical fracture. Trans means across. Cervical means in reference to the neck. So this is the neck of the femur. That's why it's called a transcervical fracture. Just a quick pause to do our Module 4 path access code for this week. The access code is 556252. Again, the access code is 556252. And then number 15, our answer here is the anterior cruciate ligament, A. And this is our ACL here. And you can see it's a little difficult to see in a drawing, but you can see how the ACL arises from the back of the femur and attaches to the front of the tibia. Okay, orthopedic surgery intraoperative procedures review. First things first, you are going to pause the video and answer numbers 1 through 15 on your own using the test taking strategies. When I say pause your video, answer the questions using our 4-step system. And then when you're ready, come back and we'll review the answers together. Okay. 1, 2, 3, pause. Welcome back. All right. Our answers for this section. Number 1, patient positioning for an Achilles tendon repair is going to be prone. Number 2, the autograft for ACL reconstruction is C, the patellar tendon. This is an image where you can see the 3 most common autografts for an ACL, the most common being patellar tendon, but other autografts that you can harvest are going to be quadriceps tendon and hamstring tendon. There are also allografts that you can utilize as well from cadavers, but those 3, patellar, quadriceps, and hamstring, are the most common autografts that we will harvest from the patient themselves. Number 3, the single largest risk in rigid casting is compartment syndrome. Number 4, the big heart procedure is for recurrent shoulder dislocation, C. And as you can see here, this is a torn labrum, and because the labrum is torn, the shoulder keeps popping out of its socket. Number 5, the answer here is going to be D, shoulder arthroplasty, because a knee arthroplasty and ORIF of the ankle are both distal to the knee, which is going to allow it to be possible to use a pneumatic tourniquet of the lower extremity. And then an ORIF of the radius is also going to be distal to the elbow. So we can put a pneumatic tourniquet on the brachial artery on the upper arm. So that's why A, B, and C, we can use a tourniquet. Shoulder arthroplasty, there's nowhere for a tourniquet to go. Okay, when performing hip replacement, number 6, the instrument used for an acetabulum preparation is going to be C. This is our reamer. Number 7, positioning for hip ORIF would be on a fracture table, C. Number 8, the answer here is going to be C, the guide pins. Here's an image where you can see, usually the guide pins are going to be a K-wire, can be either threaded or non-threaded, but most often it's going to be a K-wire guide pin. Number 9, the first step in pneumatic tourniquet application is protecting the patient's skin. So D, wrapping of web roll over the tourniquet site. First things first, protect the patient, put the web roll over the skin, then apply the tourniquet cuff, and then we'll do surgical skin prep and then exsanguination. So if we're looking for a specific order of operations, it would be the web roll first, then put the tourniquet cuff on, then do surgical skin prep and draping, and then exsanguinate the extremity. Number 10, this answer is going to be B, knee arthroplasty. Anytime we're doing a total joint reconstruction, it is common practice to use a hood or toga or sterile surgical helmet system. Number 11, our answer here is going to be A, the Colles fracture. This is what the Colles fracture looks like. It's very common distal radius fracture for anyone who has fallen and tried to brace themselves during their fall. That is a very common certification question. Colles fracture. Number 12, triple arthrodesis is to treat an unstable ankle. This is an A. The 3 joints are shown here in the image. And you can see this is going to fuse the 3 bones together. That's why it's called an arthrodesis. Arthro meaning joint, desis meaning fusion. Number 13, our answer here is A. This is a closed reduction. Number 14, the answer here is going to be C, a class 3 contaminated wound. Number 15, the answer here is Homan, B. And that's what the Homan looks like. Okay, last section is going to be a preoperative procedures review. As you guys know, we're going to do the answers on your own using our test taking strategies. On the count of 3, I will ask you to pause the video, answer 1 through 15 on your own, and then come back, press play, and we'll review the question answers together. On the count of 3, 1, 2, 3, pause. Welcome back. All right, number 1, our answer here is C, polymethyl methacrylate. Number 2, our answer here is A, 4x4 gauze. Number 3, the answer is D, incision or entry into the body. Number 4, the answer is Robinson, D. Number 5, the ophthalmic prep, you always need to use dilute povidone iodine. This is C. Number 6, the answer here is sequential compression devices. Sometimes I have to say that slowly, but we refer to them in the OR as SCDs because the SCD devices are used to prevent deep vein thrombosis from occurring in the legs. The reason deep vein thrombosis can occur in lengthy surgeries, especially in bariatric patient populations, is because the veins are not pumping the blood very quickly when the patient is either in supine or prone or whatever surgical position for a number of certain reasons. But essentially the idea is the sequential compression devices are helping to pump that blood through the veins and preventing venous stasis, because venous stasis, like kind of the slowing of the blood flow, can lead to clot formation. So we're trying to prevent clot formation by using these SCDs. If a clot does form and that is in the deep legs. That's called a DVT, a deep vein thrombosis. If it dislodges, it can be potentially fatal because it will travel through the venous system up to the right atrium of the heart, and it can lodge itself into the pulmonary artery, and that can cause an obstruction leading to a decrease in oxygen-rich blood. So that's why it's potentially fatal complication if a patient has DVT. That was a long-winded explanation. Sorry about that. Okay, back to business. Number 7, our answer here is called D, the universal protocol. This is also referred to as the timeout. Number 8, our answer here is B, placing the first towel closest to yourself. Number 9, our answer here is B, laparoscopic assisted vaginal hysterectomy. This is what the combination abdominal perineal drape looks like. For laparoscopic assisted vaginal hysterectomy, there is fenestration in the combination drape so that we can do the laparoscopic assisted portion of the procedure, but we still need an access to the perineum and the vaginal vault because this is a vaginal hysterectomy. We do need to deliver the uterus through the vaginal vault, so that's why we need this combination abdominal perineal drape. Number 10, our answer here is metal. B, the rest are insulators. Glass, plastic, and rubber are all insulators. The only conductive material there is metal. Number 11, our answer here is propylene. Polypropylene is the chemical name for this suture material, but it is non-absorbable monofilament. Number 12, our answer here is A. Open the first flap away. Okay. This website here has a fabulous article and video explaining in detail how to sterilely open an envelope folded instrument tray or package. So please use it. Number 13, our answer here is C, grasp the gown below the neckline, and then you have to step backwards so that you don't potentially contaminate while you are gowning. 14, our answer here is B, calculi is another word for stones. You can't put kidney stones or bladder stones into formalin because it could dissolve the stone. And then last, number 15, our answer here is C, on the sterile field, specifically either inside or around the surgical wound or on the patient drapes. So that would be our on the sterile field. Once we're done there, Mayo stand, back table, and then anything that has either fallen or been thrown into a kick bucket off the sterile field. Okay. That is it for me today. I really appreciate you guys being here as always. If you have any questions, this is my contact information. I hope to see you again next time. Thank you.